Swadikap, and good afternoon once again. Welcome back to the English language summary of the daily press briefing here at the CCSA. And today is Tuesday, the 22nd of June, 2021. So thank you to Dr. Tawisin just now for the summary that he gave. Today, of course, every Tuesday, we have the cabinet meeting. And today, the Phuket sandbox will be considered in detail by the cabinet and approved. We will provide you with more details about this scheme, the Phuket sandbox scheme, tomorrow. However, it's very good to note that the numbers in Phuket are not that high. Actually, the province of Phuket is ranked number 28 in Thailand compared to other provinces. So, of course, I believe that Bangkok is on the top, and then Phuket's 28 out of the 77 provinces. So, they're doing good progress there. On vaccination, I'll move to the update on the number of vaccination, as we always do. From the start of the vaccination drive on the 28th of February until and past the first day of the official launch, which is the 7th of June, until as of yesterday, the 21st of June, 2021, there had been a total of 7.9 million doses administered so far in Thailand. And as we have informed you, our target for the month of June is 10 million doses. For yesterday in particular, we had 227,000 doses of vaccine administered. So hoping that we'll continue to keep the pace, so in order to reach the target of around 10 million doses per month for the month of June. Now moving to the general situation and statistics that we have. New confirmed case, 4,059. The number of cases that are those who have recovered and been discharged is 2,047. The total number of active cases that we have is 35,836, out of which 1,479 are in critical condition, and out of that, 410 are patients on ventilators. It's interesting to note that the number of confirmed new cases for today is around 2 times higher than the number of new recoveries. So it's actually reversed from the past days wherein the number of new recoveries are 2 times higher than the number of the new confirmed cases. So hoping that this will not be the trend, hoping that the vaccines administered will make a very good impact on this, and we'll able to treat patients in a higher number and having patients recover and being discharged. The new fatalities recorded for today we have is 35. Bangkok is by far the highest number, the province with the highest number of fatalities, being 15. And other provinces with fatalities include Samut Sakhon, Samut Prakan, Cha Cheong Sao, and one each from Chonburi, Nonthaburi, and Nakhon Si Thammarat, as well as Ayutthaya, Phuket, Suphanburi, and Udon Thani. Out of today's fatality, 25 were male and 10 were female. Most fatalities today had underlying health conditions. The accumulated total of fatalities in Thailand, as you see on screen in the red box on the right, is 1,693. For the overall situation of the cases in Bangkok in the provinces is actually on a slight upward trend, while the number of cases found in prisons and penitentiaries have decreased. So health authorities have reported COVID cases in 59 provinces today, with the majority of cases still located in Bangkok and its periphery. So coming up on screen, we'll have a list rundown of the top 10 provinces with COVID cases recorded for today, the 22nd of June. So we have there Bangkok at the highest number, 1,154. Samut Prakan, 669. Chonburi, 335. And Songkhla and the other provinces is around 200 plus down. So you see on screen now Samut Sakhon, Pathum Thani, Nonthaburi, and other provinces, ending with Rayong at 63. So these are the top 10 provinces. The healthcare facilities are reporting more cases of COVID, which came from patients under investigations, or PUI, and those who are at risk of contracting the virus, or the PUI. In addition, they also found more cases from those who contract the virus within their community. There are now 94 clusters found under surveillance in Bangkok, and new clusters were also reported in provinces such as Nakhon Pathom, Samut Sakhon, Samut Prakan, Rayong, Ayutthaya, and Prachinburi, most of which you would notice are in the central region of the country. And one more province with a new cluster is Songkhla in the south. These new clusters were detected mostly in factories, construction sites, as well as radio stations. And as more provinces are reporting an increasing number of cases, the CCSA continues to closely monitor the situation and conducts daily assessments on the efficacy of the public health measures in place for each location. And since the 1st of April, health authorities have conducted approximately 285,000 active case findings in Bangkok and peripheral provinces. Of this number, around 5% were found to be infected with COVID-19 and have been treated in hospitals. Another piece of information that may be interesting to the English language audience is about Biosafety Lab, where yesterday the Ministry of Public Health unveiled the Biosafety Labs, which were designed to test COVID and other new diseases. And this was jointly developed by Japan and Thailand's Department of Medical Sciences. So the $38.6 million laboratory were funded by the Japanese government through the World Health Organization. The Biosafety Labs, which is a level 3 lab, were designed to prevent the leak of diseases while research on high-risk pathogens is conducted. It will be used for isolation of viruses for microbial culture, genetic material extraction, and storage of new disease samples for use in autopsies and further studies in medical sciences and disease control, as well as drug and vaccine developments. And according to the Health Ministry, these labs can cover standardized COVID tests from across the country, as Thailand aims to become an ASEAN hub for lab safety and biosecurity training. So our appreciation, thank you to Japan, who have also pledged to donate AstraZeneca vaccines to be delivered further in July of 2021. I'd just like to briefly update the expat community regarding immigration services. Some of you may have been aware of this already, that effective from the 19th of July onwards, over the weekend, you can see on screen now, you will have to be making a booking for immigration services via online booking form. Additional information can be obtained from the Immigration Bureau website. So that's the online queue service from the 19th of July onwards. Oh, I misspoke now. It was not this past weekend. It was from the 19th of July, not June. So apologies for that. So online queue only with the details there in that infographic. And there's a QR code, actually. You can get more information there. Dr. Thuisin addressed 2 questions just now. The first was about Phuket Sandbox, whether there would be any criteria for the cancellation of Phuket Sandbox if anything adverse happens. Now, if you recall, I had mentioned earlier that a contingency plan is in place for Phuket, and the authorities will be very in much strict enforcement of the various measures in Phuket. Now, there are some criteria set for Phuket in case of any contingency or emergency. For example, if there are 90 persons infected per week in Phuket, that would be a criteria for reconsideration of the scheme once it has started, or for any adjustments. Also, if all 3 districts in Phuket are affected, and in that more than 6 villages are affected, that would be another criteria. If there are COVID cases and no linkage, no contact tracing is found, no contact tracing is possible, that'll be another criteria. And if the hospital beds in the province, the hospital bed capacity exceeds 80%, that would be another criteria. So we have set actually clear criteria on Phuket. If these are, if the situation becomes worse in Phuket after the opening of the province on the 1st of July with these particular criteria, then it would be reconsidered. Some of the reconsideration of the Phuket Sandbox scheme would be possibly to decrease the level of activity, business activities, or to conduct sealed route travel, and also to have more hotel quarantine. And ultimately, if worst case scenario, then they would have to halt the scheme in Phuket. But of course, this is in preparation of a worst case scenario. If the province opens up and something adverse happens, there are more cases, and we are not able to control the infections in the province, then this would be the consideration. So clear criteria, clear guidelines and measures to be put in place if that is the case, if there is a case of increased infection in Phuket. But hopefully not, of course. And of course, preparations are underway. Today, as I mentioned, the Cabinet will consider details and the approval of the Phuket Sandbox in more detail. And then we'll be hearing from that tomorrow during our briefing or in the press today as well. So hoping for the very best for our pilot project in Phuket, the Phuket Sandbox. Where in other provinces will be following suit in due course. You may have learned that some provinces are preparing for the same scheme, a similar scheme in mid-July and then also in the end of July as well. We'll have to hear about that in due course. Hoping all works well. Dr. Twisin also answered a second question. He responded to a question about the interval between the first dose and the second dose of AstraZeneca, which is currently between 10 to 12 weeks. Now, his reply was that the standard is that the interval between the first and the second dose of AstraZeneca is 12 weeks. That's the standard that we set. However, there have been studies and proof in other countries that in 16 weeks, if the interval is 16 weeks, the immunity is still proven to cover the patient, the person taking the vaccine, the inoculated person. So 16 weeks will still ensure the immunity. So that is the consideration that we have. So just in closing, I'd like to just talk about schools a little bit, since schooling in the time of COVID-19 is very important. There's an infographic there from the World Health Organization to remind you that the most common symptoms of COVID are fever, dry cough, and tiredness. So if your child going to school anywhere has developed even mild symptoms, it is very necessary to keep them at home and inform your child's school and your family and your doctor about the symptoms. This will help protect other children, teachers, and school staff from the infections and prevent the spread of COVID-19 further in the community. It's very important, as we say every day, to remain vigilant and continue to strictly observe the MHTT, and our sacrifices will not go to waste. So thank you very much for your kind attention today. Please stay safe, and we'll see you again tomorrow. สวัสดีครับ
กราบขอบพระคุณค่ะท่านณัฐพานุ นพคุณรองอธิบดีกรมสารนิเทศและรองโฆษกกระทรวงการต่างประเทศ